So I have chosen to do my presentation on applying the health belief model to quitting smoking. So my first slide is going to be my title page and my introduction, which basically states that, smoking is a very preventable cause of death. And the purpose behind the health belief model is to design and implement a strategy that works to quitting smoking. So my second slide is going to be rational and purpose. So the purpose behind the health belief model is to basically help people quit smoking. I believe it's really easy, but I know for some people it's not. So for my second slide, it just states that, theory-based approaches could probably be easier for people trying to quit smoking. And it does show, the goal behind the health belief model that helps guide people to quit smoking. So my third slide is going to be the organization of the presentation. It states that, smoking is a negative behavior, the research evidence that's on here, and then any health belief model overview that's on here. That's going to be the third slide. So my fourth slide is, my information about it. So the fourth slide is going to be smoking as a negative health behavior, because it is very negative. We don't want people to smoke. And it says that, it's definitely an addiction, and it can cause chronic diseases, multiple. Definitely any lung diseases or lung cancer, anything that is negative towards the body is going to be a negative health behavior. And it states that, it affects smokers and other people because of secondhand smoke. You don't even have to be the one to smoke it, but near it. I know it does, bother my asthma when I'm around anybody that smokes. So my fifth slide is going to be the ramifications of smoking, which again, lung cancer, heart disease, COPD. We have an aunt that has COPD. So it is definitely a chronic illness as well as just bad for you. Secondhand smoke is really bad, very, very bad for people that are around you. My sixth slide is about the introduction to the health belief model. It was developed in 1950s, and it definitely helps with quitting smoking. It's one of the more applied methods. And slide 7 is just a construct of the health belief model. So, severity, beliefs, barriers, that kind of thing, everything that goes along with quitting smoking is on there. Slide 8 is the application of the health belief model for quitting smoking or smoking cessation. And I definitely have a lot of pictures on here, lots of colors. I definitely love colors, so definitely it's going to emphasize, stress. The model is going to highlight any benefits, any barriers that come with quitting smoking. It can definitely help you have reminders and, build skills on how to quit smoking. So slide 9 has the first study that we had to do. Mine was on newspaper ads in a North Carolina college, and a lot of research was done in a 30 days, and definitely issues about how to smoke, how to stop smoking, benefits on stopping smoking, stuff like that. And slide 10 was the second study, and it was on Egyptian medical and how reduced nicotine affects the body. And slide 11 is on the third study. 150 Indian dental clinic patients were recruited for a quitting smoking program and everything that happened in, reducing tobacco use and stuff like that. Let me see. Slide 12 is the fourth study, and it says, 300 Indonesian women from a community center were asked questions and, everything like that for quitting smoking and, the cultural relevance of different cultures when quitting smoking or smoking. Let me see. Slide 13 is the challenges of the application of the health belief model, and there are always challenges in anything when you're trying to quit a negative behavior. I think one of the hardest things that you have to do when you quit a negative behavior is physically doing it. So the challenge in quitting smoking is going to be, nicotine is very addictive, and it kind of overrides everything that you do when deciding on anything. So, it can override, oh, I don't need to do this today. Oh, I do need to do this today. It's definitely hard to quit an addiction. And, the cultural differences between smoking and not smoking. Some cultures believe that smoking is good for you. It helps you, spiritually, all that stuff. I don't believe that. And just long-term behavior of finally quitting and feeling better about yourself, stuff like that. So slide 14 is going to be the personal plan for changing the behavior. So, track your symptoms, better finances that come with it, any barriers that come along the way when trying to quit. It's definitely easy to set reminders. Phones are great for setting reminders on stuff. Getting in a support group would be really good because you have other people to talk to. If you have any questions or you're having a hard time, there's always somebody there. And definitely, you have to have a goal for when you're trying to stop any behavior, whether it's a good behavior or a bad behavior. Having a goal will help you get there, even if it's a small goal. Let me see. Slide 15 is going to be the recommendations. And I've got, all the colors and everything on here again. But basically, tailor, interventions that could help. You could combine different theories, different health theories with each other, and that could help also. Digital tools will definitely be a good resource for people quitting any behavior, especially smoking. There are now, there's nicotine patches you could use. There's phones that you can use to call people, and even be able to, go up on the internet and say, hey, this is the symptom I have. What can I do for this symptom? That's pretty cool. ChatGPT is a good source that you could use for any kind of goal that you want to do. You could use ChatGPT, and it will literally list your steps to do to achieve that goal. So that's pretty cool. And let me see. You can also, like I said, support groups are very, very good, especially when you have people that you can talk to that will help you get out of that mindset of the behavior that you're doing. So smoking, you can go to a support group that will help you. These are the steps that I use, maybe will also work for you. And hopefully that would work. Slide 16 is my my conclusion. I just wanted to have a good picture on here. I wanted to make sure everything was good. The health belief model definitely is a good framework for stopping smoking, and it's, it helps improve your knowledge of quitting. It definitely helps your behaviors. And you could make your health belief model a personal plan. You can have it any way that you want to do it, as long as you're still going off of the steps that they provide with the health belief model. Definitely helps with sustained changes, sticking with the change, not going back to the original behavior. So stopping smoking, it could be you smoke 3 packs a day. You could try, for a short amount of time doing, bringing it down to 2 packs, and then a couple weeks later bringing it down to 1 pack, and then a couple of weeks later bringing it down to only a couple cigarettes a day. And then you slowly start to bring that down to where you won't need it anymore. Your nicotine level in your body goes way down, especially even after 2 hours of not smoking. Your body gets way better with the nicotine, with everything. Your body will start to improve after 2 hours of not smoking anything. And then my slide 17 is going to be part 1 of my references. I do have 5 different references on here for the places that I did go for my information. Slide 18 is going to be my part 2 of my references. I have 6 more on there. If you can't see them, I can always put more on my notes. I'm going to do that anyways. My notes do go along with my my slides as well, and I just wanted to go back to smoking as a negative behavior, because I really think it's probably one of the most ones, because it can cause so many issues for you. I mean, I know stress is a big indicator, and definitely influences from your peers can be a huge impact on people, whether they smoke or not. I know I've never smoked. I've never wanted to, even though I've had friends that smoke. It's never been a thing for me. And you can become dependent on the nicotine. Like I said, it's an addiction. It definitely is hard to quit. And then it definitely can cost you a lot of medical expenses. I mean, the cost of cigarettes is super high. And then, let me see. And then for my 19th slide, I'm going to put a link on there for this video. So that will be on there. And all of my notes are going to be on my other Word document, so that they'll be on that. And I did want to say that definitely a lot of finances are troubled because of smoking. Cigarettes are very expensive now. I used to work at plenty of gas stations. I know how much they cost. I can't even believe it. Let me see. And I just wanted to go back to one of my other slides. Social impact. I know a lot of friends, when they smoke and you quit smoking, they don't want to hang around you anymore. That is also a negative effect of quitting smoking, but I think it's pretty much the only negative effect. All of the other effects of quitting smoking are positive. Your body will be healthier. You'll be able to breathe better. You won't have as many medical issues. It definitely will help if you quit smoking. And then there's definitely obstacles to quitting smoking. Like I said, it is addictive. It is hard to quit, but once you do, your body will be so much better and everything will be easier. There is that. And you always want to have confidence in yourself when you are trying to quit a negative behavior, because if you don't have confidence in yourself, you're not going to be able to do it. You're not going to be able to quit. The more confidence you have, the easier something will be for you. And let me see. go back to the challenges of applying the health belief model. So there's definitely, you know, cultural differences in certain situations, especially with the health belief model. So, I mean, you can be in one culture that is okay with smoking and another one that's not okay. So it just really depends. But yeah, that's my presentation.